This video is all about implant reconstruction. One of the missing pieces for me going through breast cancer treatment was knowing what to expect in more detail. You can look things up online, you can ask your surgeon or oncologist questions, but nothing beats hearing it from other thrivers. This video is a Q&A with a good friend of mine, Joe, who had implant reconstruction like I did. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. Do you remember the first time we met, which is at Starbucks, and we literally pulled out our phones and showed each other our boobs?
Yep, I remember that very well. It was like immediate comfort.
Yes, and I think if we were in any sort of setting that wasn't a public place, we would have absolutely taken off our shirts to compare.
Yeah, absolutely,
right?
Absolutely.
It's kind of what you do when you meet someone who's also a breast cancer survivor.
So true, so true. Yeah.
So let's go back to the beginning in terms of the timing with when all of this started for you.
Yep. So I was diagnosed in 2018, so it's 7 years ago now.
Okay.
And
so you're I'm almost 4 years, so you're 3 years ahead of me.
Yes. Yeah. Okay. Treatment was surgery in March, 4 cycles of chemo.
Okay.
And then radiation for 5 weeks.
Okay.
So from start to finish, I would say the treatment was about 6 months.
Right. And then one more surgery at the end.
Exactly, yeah. So a year later, that was when I did my exchange surgery.
Okay.
That's right.
And then in terms of your cancer, you remember what stage?
It was stage 2A, and that was a bit of a surprise because the surgeon had thought that they caught it early and that it would not have gone into a lymph node.
Same.
Yeah.
Same. Yeah.
So surprise, it was in one of 3 lymph nodes, and it was 7 millimeters, but that was enough to actually send me on the chemo route.
Right, right. I think we were similar, estrogen, progesterone positive,
yes, HER2 negative, exactly, yes.
In terms of hormonal therapy?
So I would say 6 months after my surgery, I started tamoxifen. Okay. And so 7 years out, I'm still on tamoxifen.
Yeah.
Yeah, still taking it now.
Yeah. And that will be for?
I think up until 10 years.
Yeah.
Yeah.
I'm doing 10.
Are you?
Yeah.
Okay. Yeah, it was interesting. My oncologist had suggested that I take a break from it.
Yeah.
And I tried it about like 6 years in. I took a break.
You were having all those symptoms.
I was. And so I took 3 months off and the symptoms just got worse. And I just thought, okay, devil, like just stay on it. So, and then there's been, conversations about switching to an aromatase inhibitor. And I just, again, I'm like, devil, I'd just rather deal with this and do it for another 3 years.
Yeah, no, that makes sense.
Yeah.
There's so many decisions to think about when you're first diagnosed, so let's start with those first few decisions. You had your initial consult. Was it ever brought up that you could do a lumpectomy, or was it always a mastectomy? Because at that point, they don't even know that your lymph nodes are involved until after surgery when the pathology report comes back. Yeah.
That's right. So I was in a bit of a unique situation in that I had already had 2 previous scares, if you will. Okay. So back in 2000, I had a lump that was a fibroadenoma that was removed. And then in 2011, I had a phylloides tumor that was removed. Okay. And after that was removed, the surgeon said that he wanted to go back in to get better margins, but I just found out I was pregnant, and so they just monitored me. And then it was sort of, once I was released, I was put into a high-risk program, and that's how it was found.
Oh, that's how it was found?
Yeah,
I didn't know that. Okay.
Yeah. So it was just routine, like go in for your mammogram and ultrasound and MRI, and that's how they found it. And so it's a bit of a funny story because then it was the same surgeon that had done the phylloides tumor that had removed that. So I went in and I said, I'm back. Remember me? So this time, here's what we're doing. We're doing a double mastectomy with reconstruction.
Right.
I just went in, guns a-blazing, and I just said, that's what we're doing. I was very clear on what it was that I wanted. And so then to answer your question, he said, well, we could do a lumpectomy. We could do, sort of talked about different things. And I just said, this is not up for discussion.
Yeah, I think when you have a previous history, because I had a lump a year prior to my diagnosis on the other side. I forget if you even knew.
No.
We met a couple of years ago, so we actually didn't even know each other when either of us were going through treatment.
Right.
Yeah. So I had one on the other side. It was benign, but I was just as decisive with a double because it was on the, I mean, there were many reasons why I chose that, but you know, that is one of them. I was always thinking, oh, I don't want to deal with that.
That's exactly it.
Yeah.
That was exactly it. Because then the conversation turned to, well, we often try to have women save the healthy breast.
Yes.
And I said, I get that, but I did not want the stress and anxiety of every year going for another mammogram and tests.
Yes.
And like, again, I was already in the high risk program.
Right.
It was just a no-brainer for me. So, and then the surgeon didn't push too hard on that.
Okay.
And just said, given your history, I can support this.
Right. Okay, that makes sense. Yeah, I didn't get any pushback at all asking for a double. Yeah.
Yeah.
So,
because I think a lot of women do. I think a lot of women
I
do,
know,
right?
I know.
And it's
I know.
sad. Yeah.
Yeah. And then you feel like you're going against the grain to make some of those decisions.
Exactly.
At a time where you're already feeling probably super vulnerable.
Totally.
Right?
Totally.
So it's even, I think, harder to advocate for yourself in those situations.
Yes.
So you said you knew you were doing double plus reconstruction. And I almost thought of it the same way, in that I never thought of them as two separate decisions. Like, what am I doing for my cancer surgery, like lumpectomy, mastectomy, single or double? And then what am I doing for reconstruction? For me, it was always wrapped up in one thing.
Yeah.
It's like, I knew it was double plus reconstruction.
Yes.
Yeah.
Yes. So exact same for me. And in fact, I remember having my initial consult with the surgeon. He brought in the plastics team right away. And I remember saying to the plastics team at one point, I said, I feel like this is a conversation about a boob job. Like, let's focus on the cancer.
Yeah.
You know, but it was like, they just said, they're like, well, we don't think it's going to be in a lymph node. We think it's just going to be pretty straightforward, and we'll just do the reconstruction right away. And so it really focused on boob job.
Okay, so you ended up doing a 2-stage reconstruction. So double mastectomy, tissue expanders at your first surgery.
Exactly.
Then an exchange surgery down the line.
That's right.
So were you given the option to go direct to implant?
No, I was not. It was always, it was no discussion. It was just like, we do tissue expanders, a couple fills, and then sort of 6 months later, you can do the exchange. But because I needed to do the chemo and the radiation, which wasn't anticipated, it delayed my exchange surgery.
Right. So you knew double plus reconstruction. Was there any percent that you were gonna do flat closure? Or did you know?
No, that was never a consideration for me.
Yeah.
And I don't even know why, but I just knew that it was going to be reconstruction.
Yeah. I was the exact same. I'm so grateful for these because I think I knew I wanted reconstruction.
Yeah.
And I think that my headspace would be very different if I, had complications and wasn't able to have them.
Right.
Because I knew what I wanted versus making the decision of, I want flat closure, and then maybe your headspace is different going into that. Do you think that if you were how old at the time?
I was 44.
Okay, so I was 43, so similar.
Very similar, yeah.
So if you were older, do you think you would choose flat closure? Like, you never know unless you're in that position, obviously, right?
I know. I still don't think that I would choose it, no.
I had this conversation with my mom, who's turning 80, and so she said she absolutely would not be doing reconstruction.
Yeah.
And if I were 80, I don't know if I would be at that age, but in my 40s, 100%. In my 50s, I think I would still do it. 60s, yes. 70s, I think I would think about it more.
Okay, that's a good point. So I didn't get what you were thinking, what you were saying in terms of age, but if I was 70s, 80, probably not. I would probably do a flat closure then. But it's hard to say. It is hard to say. And I mean, who knows, about the implants now and whether they're going to need to be, exchanged or anything. Like, none of those conversations have happened. So I don't know if there will be a time that I don't have the choice, but as long as I have the choice, I would continue to have the implants.
Right, okay. Yeah. So we had differing sort of recommendations with that. So because you were under the impression that you're good to go with your implants forever, right?
Yes.
And I was told by my surgeon that at about 10 years, they would be replaced. It doesn't have to be at the 10-year mark, but somewhere around then. So I have always been under the impression that I am doing this again.
Right.
Yeah.
And I did not have that conversation. It's so interesting.
Right.
No, I didn't have that conversation. I remember asking at one point, like, will they need to be replaced? And he said, well, you'll just have to see. Like, it was not a, yes, generally they last this long.
Right.
It was like, you might have to have them replaced or you might not.
Right.
It was just a very up in the air, and you just have to monitor yourself.
Yeah, because I think for some women who are going to have another surgery, and you know, you may be at whatever age when you have your first surgery with implants, and then some women decide, you know, when they're older, that I'm going to do flat closure. Do you know? Because it's later. You're not making that decision right when you're diagnosed, but at a later date.
Yeah, totally. Yeah. And that's, you know, I feel that my implants are higher than normal, and they're sitting higher. Yeah. And like harder, you know, and so I feel
theirs are
compared
compared to mine.
Yes. Yeah. And so it's like, I'll go to hug my child and it's like, you feel this thing in between, and that's just a really awkward feeling.
I know, I remember you saying that.
Yeah.
And so I don't notice that with implants. Yeah. So when I had my expanders in, that was the biggest thing that I noticed is if I would hug anyone, I'm like, oh my God, I have two balls that are like on the outside of my skin that are in the way.
Yes.
But like mine feel more squishy.
Yes. And yes, and so it bothers me, so that if I'm like, you know, 20 years out and I need new surgery, will I still elect to have hard implants? I don't know.
Right. In terms of reconstruction, so you chose implants, but there's, you know, a few options for reconstruction. Did you consider doing any of the autologous ones, like the, you know, the lap flap where you take this tissue from the back, or the DIEP, the
None
abdominal one?
of that was an option for me, just because of my size. None of that was an option.
This was not an option for me.
Yeah. It's so interesting because I know, in having spoken with you, there were different options that were presented.
Yes, and because just me being a few years later, I guess one of those options that we talked a lot about is where your implants are placed, over or under the muscle.
Yes. Not a discussion at all with me.
And so yours are
under the muscle.
Like me.
Yes.
Yeah. And so I remember, again, many conversations about this, many tears on my end, that, you know, I really wanted over the muscle, and then my surgeon was deciding in the OR whether I could do over or under, and then I wasn't a candidate to do over. So mine are under. But you weren't even given that option. No. And I think as the years have progressed, more patients are getting over the muscle compared to 7 years ago, right?
Yeah, I think so.
Yeah, that is a bit more of a difference.
Yes.
Another decision to make, I don't know if you even had this decision, was nipples. So skin-sparing mastectomy, nipple-sparing mastectomy.
So that's interesting. We had decided on a nipple-sparing bilateral mastectomy.
So keeping your nipples.
Keeping my nipples. But the morning of, as they were marking me up, I said, take the nipples.
Really?
I did, because I had read before, and it's like, you know, you're reading right up until the surgery, and I just thought, like, the odd chance that, you know, there's something left behind, I just wanted it all gone.
Yes.
And so I had to re-sign the form, and then that morning, so I had skin sparing.
Okay, so I had the same, but I made the decision basically at my first assessment with my surgeon.
Okay.
And she said that I could try to keep them. They would do pathology in the OR to see if it looked like there were clear margins, but they do a more extensive pathology after surgery. And then if it looked like the margins weren't clear, I'd have to go back in.
Oh, yeah.
And I was like, oh, no, I don't need them.
No, exactly.
Yeah. I find post-cancer, all of this, like, it's something where, you know, you look in the mirror and you know every day.
Oh, yeah.
So, and I don't know if we know that when we're making the decision.
Right.
The impact.
No,
you know?
No, we don't know, but there's no, I have no regrets. Like, you know, that was the right decision for me to make. And you're right. I mean, every morning you look in the mirror and you're reminded, but I think it's also a reminder of strength and everything we've been through.
Sure. Yes.
It doesn't make me sad, but there's a constant reminder for sure.
That's what I find it is. It's not like I really dislike the look of not having them, but it's the reminder.
Yeah, exactly. Yeah, exactly. And then, you know, I've got scars that are they're not flat scars.
Yes.
And so we've talked about that. And so sometimes, you know, depending on what I'm wearing, I feel like you can actually see the scar because it's a little bit concave, I guess.
Like almost indented a bit. Yeah.
That's right.
Yeah.
That's right. And
because sometimes they can be almost protruding a bit.
Yes.
Especially closer to surgery, and then they tend to flatten, soften.
Yep.
Yeah.
Yeah. So there's times that I'm sort of sensitive about that, but then I've kind of gotten over it because I realize like other people aren't thinking about my boobs like I'm thinking about my boobs. So I might notice something, but it's not obvious to others.
I know. So but it still plays with your
totally
mind.
Takes up headspace. Yeah, absolutely.
Yeah.
Absolutely.
Yeah. When I had my consult with my plastic surgeon at the beginning, I never had the option of choosing different brands of implants. So mine are Mentor. And the only thing we really talked about was the size and then how much projection there was. So the profile of the implants. Did you have options?
Did not talk about profile.
Okay.
That's new to me. At the time that I was going through my surgery, they were kind of just starting to phase out the teardrop textured because there was some new research that showed that was that there were other cancers potentially. Sure. And so I elected for smooth round.
Yeah, because you can either, back then it was either smooth or textured.
Yes.
And then either round or teardrop.
That's right. Okay. That's right. And in terms of brand and size, the surgeon said, once I'm in there, I'll make the decision based on what's best for you. And I won't know at the time. So we didn't talk profile. We didn't talk any of that. But there were a couple. I know he brought in a few different brands and sizes.
So do you know what they do in surgery? So they have these sizers. Yeah. I mean, I haven't seen this myself, right?
Yeah.
But you know, this is what I've read.
Yeah.
And they put them in these sizers. So not the actual implants that you're going to end up with, right?
Okay.
For cleanliness, obviously you only want to touch those ones.
Yeah.
But I think they even sit you up and then they look at you. And it just feels so like weird and vulnerable when you're not awake.
Totally.
When that whole process is,
exactly.
you know, taking place.
Yeah, I didn't realize that.
Even though it's not, you know, we're not going in for a boob job, but I don't know, it just feels weird to think that there is that aesthetic component to, you know, putting these in for reconstruction.
Yeah, exactly. So yeah, I ended up with the round smooth. They're 400s. I know that's sort of where I ended up.
Okay, that's what I was gonna ask. And so were your tissue expanders the same cc's, do you remember, as your implants? Because mine weren't. I was 275 cc expander and then 310 implant.
Oh, interesting. So right after my surgery, my mastectomy, they put in the tissue expanders and they filled them with 240.
240 in surgery?
Yes.
Mine were 75. I had these like tiny little like breast mounds and I was thrilled that I saw something there.
Yeah.
That I woke up with something. So yours was almost filled as much as mine are now. Waking up.
I don't feel like it was, but when I went back to look at my notes, and I know I only had 2 fills after that. So, and the 2 fills were each 100. So I went from, it was 240, I went up to 440. So they actually overfilled.
Oh yeah. I know
right.
They do that.
And then when I had my surgery, there are 400s. So yeah, but it is kind of surprising that it was 240, isn't it?
Right. Yeah. In terms of the size, because we didn't know each other before, so we don't know what our profiles looked like before, right?
Yeah.
So how did it compare, and how did you even choose with the size? Because you make that decision pretty early in the process.
Yeah, you do. It was interesting. The plastics surgeon was saying, if you want to go bigger, you can. Like I sort of felt like they were almost encouraging bigger because I was pretty small.
Yeah.
And so I was like, well,
small,
why not?
As in?
I was probably like a B.
Okay, yeah.
Yeah.
That's what I was.
AB.
Yeah.
AB. And so now I'm a C.
Okay.
So I did go a little bit bigger. So why not? But I didn't want to be too huge,
Yes.
of course.
Yes.
Because that would just not look right on my body. It would be unnatural. And then just with exercising and all of that.
Yes, that was
just
the same
gets in the
as
way.
me. How did you get input from family, your husband, like when you're making some of the decisions?
Yeah, so I was so resolute in my decisions. I just knew what I wanted. I think because I'd already had a couple of surgeries, because I was in the high risk program, I just knew that, like, I would have done a preventative double mastectomy if I could, right? Like, and I had that conversation, and they said, well, no, that's a little bit much, right? Like, I didn't have the gene, I didn't have there were no markers that would have supported that until I actually then got cancer, right? So no, I would say, like, my husband was he was really supportive in what I wanted to do, and I just knew what I just knew.
Yeah, I was exactly.
There were decisions that he helped me make, like around the chemo, because there were 2 different options for chemo. So, we sort of talked that out, but again, it was just more of a sounding board and just being supportive.
Right.
Yeah. Supporting because I was well informed. My mom had gone through breast cancer, so I was very well versed. And so I just knew what I wanted, and he just supported those decisions.
Right. Let's talk more about your first surgery. Because you had a skin-sparing mastectomy, your incision is right across the center of your breast.
That's right.
And then about how long?
3 inches.
Yeah.
2 to 3 inches, if I had to guess.
Yeah.
I think is that the same for you?
Probably 2 and a bit.
Yeah.
How many drains did you
So I just had 1 drain on either side.
Okay.
So 2 drains total.
And then where were they for you?
They were on the outsides.
Yeah, same. Mine were there too.
Like outsides underneath.
Yeah.
And mine were in for about 2 weeks.
Ooh, yeah, I've heard that.
I know.
Mine were 6 days.
Yeah, that's good.
Yeah.
That's good. No, mine were 2 weeks, and then when they were taken out, I got an infection on the healthy side.
Okay.
And I was in the hospital for about 5 days
Wow.
on antibiotics. Yeah, it was not good. But in any case, and just the irony that it was on the healthy side too, right? It had nothing to do with cancer.
Yeah.
But yeah, so drains on just 2 drains on either side.
Yeah, they're pretty uncomfortable.
They are.
Yeah, I remember. I don't think that they stopped me necessarily from doing anything, with my arms, but they were uncomfortable doing it.
Right. I agree. Because it was 2 weeks, I can remember going to the shopping mall with my drains.
Oh,
I was just like, I needed to get out. I needed to do stuff.
I
was
was
let's
like,
go shopping.
I don't know. I think the 2nd or 3rd day I was out and about doing things.
That's awesome. Yeah.
When you were at the hospital, was that the first time that you saw yourself, or was it when you went home?
It was when I went home. That I can remember being just shocked. Like it's
what was your reaction?
Well, I knew, you kind of know what's going to happen, but just when you see it, it's just a different feeling, and it's shocking because you don't know what it's going to look like until you see it on yourself.
Yeah, because you can see all these pictures.
Yes,
but it's so personal. When
it is. But I got through it really quickly. Like, I didn't dwell on it. I didn't let myself cry. And maybe that was an issue. I don't know. I didn't get sad about it. It was like, okay, keep going. Step 1 done. Keep going.
I was the exact same. I didn't have any emotional reaction. I saw mine for the first time when I was getting changed to go home. So I went home the evening of my mastectomy. Yeah. And the nurse was helping me in the change room. And I was just like, that's so interesting. Look at that.
Wow.
And like no reaction at all.
Yeah. And I can't believe you went home the same day.
COVID.
Yes.
Yeah.
Okay, fair.
Yeah.
Fair.
Young, healthy.
Yeah.
You go home
Off
early.
You go. Yeah, fair. Yeah.
Yeah. They said if I was older, I would have stayed.
Yeah.
I would have stayed.
Okay.
But I think our body and our mind does that so that we can keep going.
Totally.
Because I think if you process everything at that stage, maybe for some people it's helpful to fall apart then. But for me, it was just like, what's the next thing?
Yes. Yeah. Yes, totally. And I remember being at home and recovering, and I had like, the angled pillow and everything, and sleeping. Yeah. On an angle, on an incline, and with pillows under each arm, and like doing all of that, and And I remember just thinking like, wow, this is a lot. Like I can't handle much more of this. And then I got my infection and ended up in the hospital. And it's surprising. It's like, yeah, you can handle more.
More, yes.
You can handle whatever's thrown your way.
Right.
And you just adjust and but keep moving forward.
Right,
Yeah.
right. With the tissue expansion process, did you have pain when they were not just injecting the saline in, but with the overall process?
No, it wasn't painful. I was actually fascinated with the process because it was kind of interesting that there was like a magnet.
Yes.
Is that, yeah, so you have this magnet and that's how they find where they're doing the fill.
Yeah. And your port actually, so mine was central, but yours was
mine was up here.
Top.
Yeah. On both. Yeah. So I didn't feel the injection.
Okay, that's good.
It was not painful, but there was discomfort, just some discomfort.
Yeah.
Because, and maybe as we're talking about this, maybe because it was on top, they felt very full and very high. And it took me a good like 4 days post-fill to feel like they were settling. So it was just this really weird feeling. I'm walking around feeling like there's almost balloons on me, if that makes sense.
Yes.
You know, it was just kind of weird, but then it settles.
Yeah.
You know, your skin expands, it does settle and it drops a little bit. But as we're talking about this, maybe that's because I was being filled on top, maybe that's why I felt so high.
Yeah, it's interesting because I don't know, there's so many factors, right? Why one would feel something and someone else wouldn't. But I never had that sensation that they felt so high or that feeling. But they just looked and felt so round.
Yes, yes.
And like just so obviously round, like these balloons or balls on me.
Totally.
It
And
was
for me,
so
one was
weird.
Yeah, and like one was a little bit higher than the other, and one was like they weren't sort of like in the right place.
Yeah, mine was.
You know,
my tissue expander on my non-cancer side was a bit out to the side.
Yes.
So things never looked.
It's not proportional, right?
No.
It's not at all. And I remember having that conversation with my plastic surgeon, and he just said, it's okay. Like, you know, we'll make it look right.
Because they're not the final.
Exactly.
Right.
That's right.
And then you said you ended up having it a bit delayed. So it would normally have been, you were told 6 months. I think I was told 6 to 9 months.
Okay.
And then it ended up being how long after?
Because I had to go through chemo and radiation,
Right.
that was delayed.
Right.
So it was 6 months following radiation. That's when I had my exchange surgery.
And did you notice, so for me, after radiation, once all the radiation effects kicked in, like a couple months, the fibrosis, so my expanders just felt hard in general, like we talked about, but my expander on the radiated side was just harder. Did you notice a difference like that?
I didn't notice much of a difference, no, because they were both hard, and as I said, my implants are still fairly hard. So no, I wouldn't say I noticed that, but there was some contraction from the radiation.
Yeah.
So it almost became a little bit smaller.
Yes.
But not. I wouldn't say it wasn't any harder for me.
Right.
Yeah.
Yeah. Normal, but annoying.
Yeah, exactly. So then when I had my exchange surgery, the 6 months later, I was told at the time that it could be challenging working with radiated skin.
Yes.
And because, again, they hadn't anticipated that in the beginning, right? They didn't think I'd need radiation and everything else. So anyway.
That made me nervous.
I know.
Because there's some women who have complications, you know, even when you had the infection, some people lose an implant. You need to like go back in the process and have more and more on top of what's already...
It's so true. It's so true. And actually, I almost lost that tissue expander when when I was in the hospital. So, so there's all these complications that you don't need when you're going through cancer treatment.
Right.
You know, you just, you really don't need them. But in any case, once I had the exchange surgery, everything went well. It was fine. But then I noticed after that there was some more contraction on the radiated side.
Right.
So, and then I went down this rabbit hole of my boobs don't look the same size, one is higher. I went back to my plastic surgeon and he said, you know, I can go back in, but it's radiated skin, but I can do that. And I was like, no, let's just call
because
it.
I remember you saying something about you thought you were going to do a revision surgery.
Yes. Yeah, I totally thought that I would. Because I was really, again, I went down this really dark rabbit hole of being obsessed with the fact that they were different sizes because they weren't with my natural breasts.
Yes.
Like they,
yes.
you know, I know that they say that they're sisters or whatever the saying is.
Surgeons will say that breasts are more like sisters and not twins, meaning they look alike, they're not identical.
That's right.
But we've talked many times about this. What is the expectation when you have both breasts removed and you get 2 new ones from scratch?
Yes.
What are you expecting?
Perfection.
Yeah.
Yeah. Yes, I am.
Yeah.
And especially like having those conversations. And so, you know, my surgeon or other doctors would say, well, even when you have your natural breasts, like they're not the same size. And I was like, but I felt like mine were.
I know.
Like, it never bothered me.
Right. Mine were pretty symmetrical too, but if I have this conversation with anyone who didn't have cancer, 9 times out of 10, they'll reflect on themselves and say, mine aren't the same either.
Right.
But it's like, it goes back to, yes, but mine were removed, got 2 new ones.
Yes.
I have a different expectation.
Exactly.
Yeah, it's not a reasonable expectation.
No. Fair.
I know that.
Right.
But you do expect that. And I have differences side to side. I had more tissue taken out on the cancer side. So it just, like this side looks smaller, and then add in the radiation, right? Contracture. Yeah. So your radiated side, it feels high.
Yes.
Yeah, and looks high.
Yes. It feels high, but again, I, you know, was obsessing about it at one point, and then I did get over it because I thought that's not a healthy place to be.
Right.
And I'm putting too much thought into it. When I see you or anybody else, they're not saying, wow, your one breast is higher than the other, right? Like nobody's saying that.
Right.
But I will say, like, it's kind of changed, like some of the clothes that I wear. Have changed. So sometimes, you know, I'll be wearing a tank top that's just like a scoop. Yeah. And I feel like my boobs are really high. So like it scoops down too much. Yeah. Wearing like a bandeau bathing suit, I feel like I need a long line one so that it's kind of straight along here.
Because it looks almost too obvious if you just have it.
Yeah, I feel like it would be on an angle.
Yeah.
You know? Yeah. And I just don't want to draw attention. So I just feel like I'm just dressing a little bit differently.
Right. I definitely thought all of those things of like, this annoys me, this, you know, but I never thought I would do a revision surgery. Like things would have had to be like pretty bad for me to do that. I think maybe because I knew that I was probably going to do it again. Right? So, I mean, it's a long time if you were unhappy to wait, right? 10 plus years, whatever.
Yes.
But maybe I thought, if I'm unhappy, you know, whenever I eventually do that, you know, but I would have had to been pretty like annoyed, upset, frustrated to do a revision surgery for myself. Yeah. Fair. And I think, you know, I'd made the appointment with my plastic surgeon again to go back and talk about what the options were. And because you're right, I was considering doing a revision surgery, but as soon as he explained the difficulty in going back into radiated skin, I said, okay, like we're not doing that, and I'll just accept where I'm at. Right. So, and I did, I did. Did you notice the difference in your recovery after the second surgery? Oh, for sure, it was a breeze. Yeah. It was a breeze. You know, comparatively speaking. Yeah. So I didn't have to wear like a band or anything like that. I know I was going to ask you about that. Yeah, like I know some people are like sort of wrapped up. I don't even know what it is, but no, my doctor just said, you don't have to wear a bra, you don't have to wear anything. Just so that was after your exchange surgery? After my exchange surgery. Okay, so let's go back and talk about after your double mastectomy with tissue expanders in. So you woke up with some fill, like a decent amount of fill. So after that surgery, were you wrapped up in anything? Nothing. And was there a recommendation to wear a bra then? No. Okay, so after your exchange surgery, it was the same thing. Same. Which then when I talk to people about this, they're surprised. And because I think you had a band, didn't you? So after my first surgery, no recommendation at all to wear anything. Okay. And then again, I woke up with 75 cc's, so these like mini boobs. Yeah. I was so happy with them, but you know, I didn't really need a bra. Yep. And then after my exchange surgery, at my first post-op appointment, my plastic surgeon said, you need to make sure you're wearing a bra. And so there was no recommendation of a particular one. Okay. But after my surgery, immediately, for the first few weeks until I had that appointment, I had been taped. And so it was like pretty tight, almost like a bra. Okay. And the reasoning she said to wear a bra after the exchange surgery was more to do with radiation. So if the radiated side you know, it wasn't just you need to wear a bra post-surgery, it's you need to wear a bra ongoing.
Right.
Right? So the radiated side is going to stay there. It's really not going to drop that much over time, but you do have normal, healthy tissue on the other side with an implant that has some weight to it, and then that will, over time,
oh, interesting.
you know, just like anyone with breasts who are our age, you know, things are going south, right? And so that will happen on the other side. So to minimize the amount, like the discrepancies side to side, that was, I think, the reasoning for the bra then.
Right.
But I had lymphedema after both surgeries, and I found out about compression bras that would have been awesome to wear then, but I didn't know about them.
Yeah, same. And so none of that was recommended to me. Like I was not taped. There was no compression bras. None of that was recommended to me. So, and I don't even remember, like, I don't think I was specifically told you have to wear a bra. Like I just did because I knew I wanted to, just to kind of feel normal, you know, more than anything, more than whether I needed it or not. I just wanted it to feel normal. But I don't recall having a conversation about needing to wear a bra, and I certainly wasn't taped. Like it was really, really interesting because I've had these conversations afterwards, and everybody's experience is so different.
So different, because some women come out and then they have a bra that's given to them by the hospital that this is the one that we want you to wear.
I know.
Let's get into some of the changes that you may or may not notice post exchange surgery. So do you have rippling?
There is some rippling, yes. And especially if I'm bent over, that's where you see the rippling.
Yeah.
But standing up, I don't really notice it. You know, again, the only thing I kind of notice is that the scar is a little bit indented.
Right.
On one side.
Right.
More so than the other, but I would say indented on both.
Okay.
But yeah, the rippling more just like, you know, you bend over and that's when you
and
can
then where
see
is it on you?
On the side.
Do you have it here too?
A little bit, but I notice it more on the outside.
Yeah. And then do you have it equally side to side?
I think so. Yes. Yeah.
Okay.
Do you?
No.
Oh.
So on the side that had cancer, there was more tissue taken out. So the skin on this side is very thin compared to the other.
Okay.
And so it's just much more obvious when I bend over that you can just see the folds, which is the rippling, is the folds of the implant.
That's right. Yeah.
Right?
Okay.
How about animation deformity? So we have talked a lot about this.
I didn't even know that was a thing, Erica, until you mentioned it to me.
Yeah.
And then I absolutely have animation deformity.
So that's when, because our implants are under the muscle,
Yes.
when the pec muscle contracts, then the implant moves up and out to the side. Every time you contract
Every
your
time.
pec. Yeah.
And it feels weird.
Yes. So it bothers me. Does it bother you?
It bothers me when I'm working out, because that's really the only time I notice it.
Okay.
Right? Like when I'm doing a motion that would create that animation deformity. That's when it bothers me, but otherwise it doesn't.
Okay.
No, it's okay.
And do you notice, because the implants are under the muscle, then the pec muscle is in more of a stretched position always. Do you notice a weakness associated with that?
So I have a lot of weakness that has not resolved. I used to be able to do all kinds of push-ups.
Yeah.
I don't do push-ups now.
Yeah.
Like I can't.
Yeah.
I can remember for the longest time, you know, you've got your Tupperware, whatever it is, and you have to, like, you know, close it.
I still cannot fully close the hard ones.
Yes.
It's ridiculous.
Yes.
I can lift so much weight above my head in all these which ways.
But it's this motion, right?
Yeah.
Exactly. So I still have weakness there as well.
It's one of those things where it's not like you work so hard at it and then you'll be what you were before.
That's right. Oh yeah, I don't think I'll ever get to the pre.
No, because the implant is sitting under the muscle.
That's
so
right.
that stretch on the muscle is always
there.
Always there.
And they don't tell you that. Like I didn't know, I mean, I'm saying they, but like I didn't know that I was going to be limited afterwards in what I was, for like indefinitely, in what I was going to be able to do.
So I knew, because I knew there was an option that I could choose. Remember, because you didn't have an option then.
That's right.
So
yes.
I knew, and I was very strongly advocating for over the muscle because of how active I am and my job is so physical. So I knew there would be limitations. I probably didn't know the extent of it or how annoyed I'd be.
Yes.
Yeah. Do you notice lack of sensation?
Absolute lack of sensation, but no different from post-surgery to now.
So it's the same?
It's the same. Yeah.
And then where is your loss of sensation mostly?
All over.
Like your whole boob?
My whole
area?
boob. My whole boob, yeah.
Okay.
Yeah.
Yeah. I am much more along my incisions, and then it gets a bit better as I go out.
Okay.
But then there's a section here that I could stick a pin in it and I wouldn't feel a thing.
Oh, wow.
Yeah, because that's the lymph node
Yes.
area.
Yes.
Yeah.
Okay.
Do you notice that your breasts are cold?
Yes. All the time.
Yeah.
All the time.
Yeah, mine are all the time.
Yeah.
It's so weird because when I had tissue expanders, I didn't notice that at all, but there's a
Right.
difference because that's saline, and
Yes.
then most of us, some people have saline implants,
Right.
but ours are silicone.
Yeah.
So they're just always cold.
They're always cold. And especially, you come back in from a run, they're even
Yes.
colder,
Yes.
right?
Yes.
So it's either really cold or just cold.
Yes.
There's nothing.
Yes.
They don't
Yes.
warm up much.
And I think that goes along with, we've talked about in the past that our breasts feel foreign almost to the outside of our body and not fully incorporated in.
Yes.
And I think it's for many reasons, but one of them I think is, they're cold, so they don't feel like they're your tissue. Do you know?
Exactly. I don't feel like they are a part of me, really. And you know the story about me going to my physiatrist, and
Oh, yeah.
he was looking at the cording and everything, and I had a little bralette on, and we were having a conversation, and he said you can put your shirt back on. I was like, oh, it doesn't bother me. He's like, well, no, but it bothers me. Like, you should put your shirt back on. But to me, I was like, I'm just sort of sitting here, like, it's not like I'm naked. It didn't.
Yes.
I
So
don't know if that makes sense.
Yeah.
But
No, total sense to me.
Yeah.
But I have the same thing as you, right?
Yeah.
So I don't feel naked per se. I'm not going to walk around outside just like
Yes.
this, but I don't
Right.
feel that if I was showing someone.
Yes.
And I think part of that is that, they do feel external to me, and I don't have nipples. So it's
Right.
not like I'm showing something
Yeah.
the same way.
Yeah.
But yeah, I do notice that not having nipples makes a difference in terms of how you view yourself, but I think
Yeah.
how others sometimes view you.
I agree, and I think like there's a couple of things. So like at one point I did think about doing that 3D nipple tattoo.
Yes, I was going to ask you about that.
Yeah, and I had actually booked an appointment.
Yeah.
Which I subsequently canceled.
Okay.
Because I was wondering if I was going to do more surgery, and then that sort of time passed. I decided I wasn't going to have more surgery, but the
Right.
scars were still pretty visible.
Yeah.
And I didn't want to do a nipple tattoo on top of that.
Right.
So I've just sort of left it. I've just left it as is. But I do feel that if I did have a nipple tattoo, I wonder whether I'd be more open to changing in front of people or something, But like I'm at the gym and I don't want to take my shirt off. Like I don't want others to be uncomfortable almost.
Yeah, I remember you saying that. So
Yeah.
I'm a bit all over the place with this. So if
Yeah.
I have close friends who know this whole experience that I've been through,
Yeah.
I'm like, do you want to see my boobs? Like,
Yeah.
I want to show them, right?
Right,
Like, look
yeah.
at all of this. This is crazy.
Yeah.
And then the other end of the spectrum is if let's say I went to a spa with girlfriends.
Yeah.
So my good friends are there, so I'm totally fine to change in front of them. And then complete strangers, I was fine to change. And then there's this middle ground where, let's say I'm at my CrossFit gym. I don't change there very often in the change room, but even recently, so I'm almost 4 years out. And so it's not like this was just the first year, right? And there are some women that I work out with, but I don't know them that well. I don't even know if they knew I had cancer.
Right.
And it's just this weird thing that I'm just standing there, and then they walk in, and I would say something. What would I
Right.
say? Breast cancer.
Yeah.
And so I wouldn't just say nothing,
Yeah,
right? Because I would just feel too weird.
Yeah.
But sometimes I just don't want to do that.
I know. I
You know,
hear
like you want to
Yeah.
be a bit anonymous
Exactly.
in a sense.
Exactly. Yeah, it's interesting. I mean, I was at a spa just a few weeks ago, and I had my robe on, and I'm like kind of going in the corner and changing because
Yeah.
I just don't want. I don't know. I'm just not comfortable with other people seeing that.
Right.
you know?
Yeah.
And I mean, some of my friends have seen, and that's fine, you know, if people are interested in, you know, I'm not.
I think you're more, or when we've spoken, you're more cautious I remember you said something about, you know, you can't sort of undo what you've seen. So you're
totally
right.
Yes. And I remember, because there was like, I remember a friend asking, and I said, "Are you sure you want to see because you can't unsee?"
Right.
And it can be shocking. Right.
Yeah.
So,
yeah. I'm like,
you're like,
you should really see this, right? Like, also because what it looks like under clothes is not what it looks like without clothes, right? And so you give the impression just, you know, having these implants that, you know, everything looks like pretty normal. I wouldn't go out and get what I have done. No. You know, let alone pay for that. Right. So I almost want people to know that it's not what you think.
No, it isn't a boob job. Like it isn't a, you know, you want bigger boobs, go and get a boob job. And some people think, well, at least that's the silver lining. And
yes. Oh my God, I hate that.
I know, right? It's like, no, it's not really. Like this, it's not as natural as it would be if you had other implants. Or like there's all of this other other issues surrounding it.
And I find that if I do have closer friends give a compliment, like, I mean, they did a pretty good job, that sort of thing, I'm okay with that. Or even sort of saying, yeah, they don't sag, but only if they know the whole other story to this cancer thing, and they know all the emotions that I've been through and the tears and the, you know?
Yes.
Because then it's like, it doesn't feel as much like someone's trying to give me a silver lining.
Right, yeah, that's fair. I totally agree with that.
Because you're 7 years out, do you look back on the experience in a different way as compared to how you're experiencing it as you go?
Yes. I remember, you know, going through it, I was very, as I've already said, it almost felt very robotic. You know, not really allowing myself to feel, or not that I would stop it or shut it down, but I just didn't have time to feel.
Yeah. Don't you think it was automatic?
It was very automatic.
Yeah. It didn't feel like it was a decision I was making to say, I'm not going to feel this part. I'm going to do that later.
Yes, exactly. And so it was like, okay, let's get that surgery date in. Let's get the chemos scheduled. You know, let's get ready. Like it was just very one day at a time, focus on the next task. And then I remember after my last radiation, there was a sense of relief. And then 6 weeks later, the exhaustion hit me. It just hit me like a ton of bricks. And then I started hearing that, radiation can do that to you. And then I would say 3 months post-radiation, I can remember it was my birthday, and I drove myself up to Wellspring and I walked in and I said, I'm not okay.
Which is like a support resources after cancer in our area.
Exactly, that's right. Yeah. And I just had the most wonderful woman talk to me. And I just said, I've been through this experience. I went through it. I didn't think about it too much. I just sort of went with what was, you know, happening to me at the time. Right. And now it's just hitting me, and I'm not okay. And
so that, just in terms of the timing, that was after radiation, but before your exchange surgery.
Exactly, it was. Yeah.
Because mine was after my exchange surgery. I was like holding it together again, automatic, not really a decision I felt like I was making. But then after the exchange surgery, like, you know, the wheels came off the bus, and that's when we met. That's right. And I was sort of reaching out to people to figure all of this out, and I was probably like a sea of tears for all the walks that we went on. It was just like streaming.
Yeah, I remember. And we all process it so differently too, right? Yeah. So I remember at the time I ended up doing like a support group. They had one for breast cancer, and so I did a support group there and a couple of different programs just to help get myself through. And I was also on a leave from work, so you know, physically and mentally, I knew I needed that leave, and so then I just started focusing on meditation and just like really taking care of myself. And so I sort of feel like I say this, but I feel like cancer was a bit of a gift for me, because it did really give me time to reset, rethink my priorities, change my diet, change all kinds of things. And I mean, I was really healthy before, as we've talked about. I mean, I worked out, and I've always been an athlete. But it really gave me the opportunity to reset and to really rethink my priorities. And so although it was a gift for me, it's something you never wish on anybody.
Right.
But in hindsight, I can look back on it, and I learned so much. And it's really changed who I am as a person.
Yeah. Yes, I call myself like Erica. This is Erica 2.0,
right?
You know, or my pre-cancer self and my post-cancer self, and there's many sort of decisions that I lean on this experience that, you know, I'm probably making different decisions because of this.
Yes, absolutely, absolutely. You know, for me, it was just crystal clear that my kids are my number one priority, and I just want to be around to raise them. And so it's family first, and it's just so much easier now for me to say no to other things.
Yes.
Because I know I need to prioritize, I want to prioritize my family, so my kids, my husband, my health. It's not perfect, you know, it's not like sometimes I still, slip into old ways, but I just more often than not can give myself, shake my head, reset, and just appreciate life, and appreciate the fact that 7 years out I can say I'm a breast cancer survivor.
I know it's 7 years. I love hearing when someone is further and further out, or know, sometimes you hear it's like, oh, I had cancer 30 years ago, breast cancer. I'm like, oh my God.
Yeah, thank you. I know, totally. Yeah.
Right. Well, thank you so much for doing this.
Yeah, thank you. Thanks for having me.
I hope you found this conversation helpful. If you had implant reconstruction, please consider writing a comment. It'll be helpful for other women who are considering this as an option. Thanks so much for watching, and see you next time.